Welcome to Skin and Health Secrets today episode. Pigmentation. Pigmentation is one of the most common skin concern like uneven skin tone, dark spots, and especially the patches that don't fade away. So let's understand what exactly that causes pigmentation and is it permanent or can it be prevented? To understand these signs, especially this special segment for pigmentation. So we have Dr. Saurabh Dhananjay, a dermatologist who has a skin clinic and a skin and hair clinic, Dhananjay Skin and Hair Clinic at Shimoga. And I also is a member of Subbaya Medical and Research Hospital. Thank you, doctor, for joining us.
Thank you so much for having me, sir. Yes, pigmentation and as you mentioned, uneven skin tone has become a lot of issue in the present days.
Okay.
So, speaking about this and discussion on this topic is very important.
Right. So, doctor, just begin. What exactly is pigmentation?
Sir, pigmentation actually is unequal or uneven distribution of melanin
Okay.
in our skin. Okay, so basically, if it happens mainly on the face, it is noticeable. So that is basically a pigmentation. Melanin is something which will actually give color to your skin. So there are two types of pigmentation. So if we speak about pigmentation, hypo, that is less pigment, that is less melanin production, hyper, that is overproduction of melanin and over distribution of melanin in different areas of our body. So if we are speaking about pigmentation, it will include both hypo as well as hyper pigmentation, sir.
Okay. Are there any, as you said, so different types of these pigmentations?
Yes, as
Yes.
I mentioned, hypo and hyper. So hypopigmentation will be like vitiligo
Okay.
and nevus depigmentosus, and there are a few moles like nevus which are coming. That will be actually hypo. And coming to hyper, we have melasma, which is the most problematic condition what we are facing, and we have acne induced hyperpigmentation or post inflammatory hyperpigmentation, and we have lichen plano pigmentosis, and also we have different kinds of melanin induced what conditions like melanoma and all of them. So these are hyperpigmentation. Like also we have sun induced like freckles, and we also have DPN, that is dermatitis papulosa nigra, and these are all hyperpigmentary conditions which actually needs discussion and also proper dermatologist oriented
Okay.
discussion.
So as you said, once again, that questions. So because to understand, this better, so what are the major triggers for pigmentation?
Uh, Triggers speaking, sir, if we are speaking about hyperpigmentation per se, it is always UV induced, sir. Most of the time, 90% of the time, it is UV induced, that is our sun induced.
Yes.
And also, we are now noticing, genetically predisposed individuals. And coming to third, we also have, hormonal fluctuations. And we also have few certain medications which will actually increase the what pigmentation. So these are few things, but mostly it is all sun induced pigmentations are the common things.
Okay. So can this pigmentation will be prevented?
uh, yes and no is my answer.
Okay.
So prevention can be done if started at an early age. Like for example, if we start using broad spectrum sunscreen in individuals who are more in the tropical areas, and like in India, if we can start using that, it is going to be useful. And coming to proper usage of creams what we give will actually help. I said no is because once the pigmentation has started, and then if you start the treatment, the prevention is not possible. So we can go towards the cure. And for that reason, I just said yes and no.
Okay. So this is, generally, I want to know, like earlier we used to see the foreigners comes to beaches for a tanning.
Yeah.
But nowadays we can see that, that is like avoiding that, we can see less.
Yeah.
Don't know the reason that tanning is a pigmentation causes or skin cancer causes. So this is in my like doubt in my mind.
No, even the things like there's a thing called, foreigners like the US, UK people will actually become red,
Yes.
and Indians become tanned because their skin type is from Fitzpatrick skin type 1 to 3 most of the time, and we start from 4 to 6. So we usually get tanned. And regarding the cancerous thing, we are still are not sure exactly about it, but yeah, in the mean course of time, we might have some study regarding that.
Uh, Doctor, usually, we hear after menopause for, females, so like they'll be having a pigmentation. So can you like
Yeah,
clear this?
yeah, sir. Okay, if I have to tell you, it is not only after menopause.
Okay.
So before, during, or after menopause, during those situations also, people are noticing more of pigmentation. Mainly melasma is what I will actually be speaking about, is because of the hormonal fluctuations which are happening in our body. And there's something called as cloasma. Cloasma happens in the pregnant females during pregnancy or after pregnancy. Soon after pregnancy, they'll start having lot of pigments, that is mostly melasma, which during pregnancy is called as cloasma. That is also basically due to hormonal fluctuations, sir.
Okay. So next, like what are the general treatment like with approaches for pigmentation?
Yes, sir. So there is something called general treatment, and there is also called specific treatment. So general treatment is basically avoiding the sun exposure, avoiding heat related things. And heat related things will actually include your standing in front of the kitchen stove, and wherever there is fire or something like that, because even the heat will actually cause more pigmentation.
Oh, is it?
Yes.
Okay. Okay.
And also, sir, it is, if we are speaking about sun protection, we actually have to tell photo protection rather than sun protection. Why, if you might ask? Because photo sensitivity is becoming a lot of issue. So photo protection will include, just like protecting ourselves from normal tube lights or candles or bulbs. Even they can also increase your pigmentation. So we need to start avoiding that, and then that will actually lead to your general measures. And coming to specific measures, we have to use broad spectrum sunscreen. There is no alternative for that. And there are a few targeted pigmentary what creams like tranexamic acid, we have kojic acid, glycolic acid, azelaic acid, and if need be, after consulting from a dermatologist, retinoids can also be used. And there are a few there are a few procedures which can be done, like chemical peels can be done, like microdermabrasion, microneedling, and there are few top end machines for lasers which have come up in the market. So we can do lasers for the pigmentary removals. These things will in turn help in managing the condition. It is not like curing the condition. We need to manage the condition in a proper way. This
Okay.
will actually help in preventing pigmentation from worsening for the client, whoever
Okay.
comes after.
So, like as you narrated about the laser treatment. So, this is a question, like about the laser. So, will skin become sensitive, or like how much that laser treatment effective for this pigmentation?
Yeah, so sir, what happens is, yes, skin will become sensitive. Of course, anything laser is gonna make sure that skin is becoming sensitive, but you need to maintain that skin. How? Basically, you need to wear sunscreen every 3 to 4 hours, and I mean, you need to reapply sunscreen every 3 to 4 hours, and make sure you are moisturizing your skin and hydrating yourself well by drinking good amount of water every day. and also properly following the standard protocol creams which needs to be applied during the day and during the night. This will actually help in managing the condition, and which will actually reduce from making the skin sensitive towards laser.
Okay. So this is I know how to like make it. I think let's like I want you to bust this myth about pigmentation.
Yes.
Like, does scrubbing removes pigmentation?
No, scrubbing will never remove pigmentation, sir. It can at times worsen the pigmentation. So let us not scrub at any cost.
Okay. So next question is one laser session cures all.
It is like one cream for everybody.
Okay.
Is it possible? No. So one laser session can never cure the whole pigmentation. If by chance the patient has melasma, if it is deep dermal or something, it is impossible. So let us always consult a dermatologist before finalizing the laser sessions.
Okay. Does natural remedies always work?
If natural remedies always worked, then we wouldn't be sitting here, sir. So yes, it works for few, but not all the time and not for all the diseases. So it needs time to time, it needs changes also. Yes, it works for few, but not all the time.
Okay. So sunscreen is optional.
If sunscreen was optional, then pigmentation will always be with you, will never leave you. So if we are speaking about hyperpigmentary disorders, then yes, sunscreen is mandatory but not optional. So make sure you are wearing your sunscreen and reapplying it every 3 to 4 hours.
So thank you, doctors, for explaining this pigmentation and this part scientifically. So really, like for the listeners, I can say that pigmentation is a common and like a manageable condition, but proper diagnosis, as doctor suggested, is the key, right? So always consult a qualified dermatologist, like before taking the treatment. Hence, this is a complicated like issue, I can say, because there are many concerns. So like it's better that your dermatologist, they'll see the like skin condition, what to be treated, what not to be treated. So like consult a dermatologist for your condition. Thank you, doctor.
Thank you, sir. And before I end it, I would also like to tell that during hypopigmentary diseases, most of the time it has become a social stigma. Let us be considerate towards patients who have hypopigmentary diseases like vitiligo. This is just absence of melanin. Melanin is a substance, or it will just give you color to your skin. That will not indicate any, trauma or disease per se. So let us be always considerate towards hypopigmentary diseases. And for hyperpigmentary diseases, make sure you're wearing sunscreen regularly and make it like your daily food. So sunscreen will be your daily things to go about. So yes, let us be considerate towards people who have hypopigmentary diseases, and let us make sure we are wearing sunscreen for hyperpigmentary disorders.
Thank you. Thank you.
Thank you so much, sir. Thank you.